My name is Andrea Watts and this is my ACMGAS301A prac, and I'm focusing on the highly contagious virus of cat flu. So it is similar to a common cold for cats. It's very, very contagious. It's spread through contact with surfaces, bowls, toys, on clothes of the person that's been in contact with the affected cat, through being in an affected cat's not properly cleaned out kennel. Which is why proper isolation is so important. Lots of us have cats that we go home to. Also, there is a risk that we can potentially infect other cats that are here with us in hospital that don't carry the cat flu virus. Symptoms include runny nose, weeping eyes, lethargy, sneezing, or a fever. And more advanced symptoms can include oral ulceration, permanent damage to the eyes, and in some cases can even cause death. We would see this more in maybe immunocompromised patients or kittens who are a little bit weaker. To limit the spread of the disease, we would put the patient in an isolation ward, ideally. We don't have one per se here, but we can utilise the spare small dog run, so that is away from the routine hospital patients, so they are completely separated. We would limit the staff too that were coming into contact with the patient, so ideally just the treating vet and possibly their nurse too if needed. For example, this patient, the vet is on hospital rounds only today. It's the only cat in hospital with us, which is great. If this vet had consults for the afternoon, say seeing other cats, we would reschedule those or move those to another vet. So this vet will just be seeing this cat today. So to treat the disease in the case of this patient, treatment is supportive. We are administering Medicam, so for its anti-inflammatory and pain relief properties. We are also administering Vibravet, so doxycycline, to treat the bacterial component, although this is a virus. So we're basically just supporting the immune system. At this stage, our patient is clinically showing discharge from the eyes and nose, and occasionally sneezing. So here we have the ward where the cat flu patient will be kept. I'm going to demonstrate in a moment how we are going to move the patient from one room to another, as in this example we have soiled our bedding. So ventilation is very important in an isolation ward. Ideally we would have closed ventilation, so that means the air would not be recycled to risk the spread of airborne viruses. The temperature in here is always kept at 24 degrees. This is through the air conditioning, and with bedding with our isolation patients. Either we want them really easily washed or ideally disposable. So in this case you can see we've got a disposable cardboard box, little hidey hole, and a disposable absorbent pad. The rest of the equipment in here is hard surfaces that we can disinfect with F10. Okay, so I'm going to demonstrate how to move the patient from one room to another. This is how we would disinfect the room if the patient was leaving, or if they had soiled their bedding and we needed to move them to a clean room. So basically I've got my PPE on, I've got a gown, I'm also going to wear gloves. Everything that's used in here will be either kept in here or disposed of. So I've set up a new room here for the patient. So first I'm moving the cage card. We have our admission form here, and then a little warning tag that explains that the patient is a cat flu patient. So all staff are clearly aware as soon as they come in here. And she's a lovely little thing. So into her new room. So to effectively clean this cage, we're going to use F10. It is mixed at a 1 to 125 ratio. So like I said before, everything in here is either easily cleaned or disposable. So I'm going to dispose of litter, the bedding, the water, everything gets completely sprayed down with F10. It's left for 30 minutes contact time, then the room will be wiped down. Including the cage door. So everything is really thoroughly doused in F10. Okay, so half an hour contact time has passed. I'm now going to really well wipe down this whole enclosure and dispose of the paper towel. Okay, so this is placed in the isolation sink. Just so it can air dry. Soaking. Okay, and I would redress this room with a new disposable pad. I will let the litter tray air dry, and I will replace that, and then it's ready for the next patient. Okay, so the kennel is clean, it's ready for the next patient. I dispose of anything that I used or wore. this rubbish is taken straight out. Ideally, if we had an isolation ward, we would have equipment specially used only in the isolation ward. So this equipment, such as this patient monitoring equipment, would be clearly labelled and designated only for use in that ward. And again, either disposable items or reusable items that can be treated appropriately. So in this case with Clinical, so everything in here needs to be able to be disposed of or disinfected.